Hi everyone, I'm Rebecca Letterman with Wake Forest University, and as you can see, I did a literature review on schizoid personality disorder. And if I could describe it in one word, I would say that what I found was complex, and in a second word, confusing. Schizoid personality disorder is a notoriously difficult disorder to diagnose and treat, and part of that reason is because it displays a high degree of stability over time. Those with this disorder do have a lower global prognosis than other personality disorders. The DSM-5 suggests that it's very uncommon in clinical settings, about less than 1%, although other numbers do indicate that there is a prevalence in general population between 3 and 5%. And I think that sort of goes to show, the hallmark traits of this disorder, lack of a desire for close relationships and preferring solitary activities. It kind of relates to lack of treatment-seeking behaviors. And so that's very unfortunate in itself because those two traits in particular are correlated, strongly correlated with medically serious suicide attempts, meaning that if no one had intervened, the individual would have completed suicide. And part of the reason for that is individuals with these two traits in particular, lack of a desire for close relationships, preferring solitary activities, they don't have the same social reciprocity or feeling of obligation to reach out for help. So with that being said, when these individuals do actually enter treatment, when counselors find themselves with an individual who is able to be diagnosed with schizoid personality disorder, it can be really difficult for counselors due to negative countertransference reactions. And part of the reason for that is because they represent sort of a outward manifestation of how others in the individual with schizoid personality disorder react to that individual. And so that can be very difficult for clinicians. So with that being said, research on this disorder and the associated traits is really important, and there's a lot of wiggle room, I think, to research more within these particular traits. And some of the other research that I read, they actually used the lack of research on schizoid personality disorder and the tendency for cluster A disorder traits in particular to blend over time. They've used that to sort of criticize the DSM-5's categorical way of diagnosing axis 2 disorders. So the DSM currently utilizes a categorical perspective, meaning that disorders are distinct clinical syndromes. But it seems that there is this nascent literature that is calling for the DSM to change over to a trait-based model, meaning it's more dynamic. A trait such as peculiarity doesn't belong to any one particular disorder, but can be studied early in the developmental process and intervened on earlier, rather than, fixating within one diagnostic framework. And so that's just a little bit about some of the research that I did, and I think there's a really good space for both philosophical and clinical discussion about this disorder and its relation to the way we counsel individuals and the way we analyze the DSM-5's model of diagnosis. And so I hope to see you all soon in my Zoom meeting. Thank you.